I was there probably a total of 8 hours. My husband came and picked me up. He was there for a few hours. They brought me down in the wheelchair to the car, and I got in.
That person may stay sometimes as an outpatient, sometimes only several hours. We may keep that patient in the hospital overnight. That person, however, will not go home until they are medically safe to go home. And that is the same thing that holds true with even the longer or the larger operations such as a fusion. Those individuals traditionally will stay in the hospital for 2 or 3 nights.
So at that point in time, my mom had enough of me, so she had arranged for me to go to a post-op center with 24/7 nurse care to kind of take care of me for the 2 weeks after surgery.
Discharge, as far as sending a patient home, what determines that? In my view, it's really 5 different factors that you have to accomplish in order to go home.
When you're in the hospital, you have a lot of people there helping you, and you can ring the buzzer whenever you need something, and if you feel that the drug's not right, there's someone right there that can deal with that immediately.
One is your pain controlled. I'm not going to send you home if your pain is still a 7 or 8 out of 10.
The pain with these surgeries is really significant. They give you a lot of pain meds. I've always been given a little button press thing where you could give yourself Dilaudid or morphine every 8 minutes.
Number 2, are you disconnected from everything? You know, you can't still have IV fluids. You can't still have a pain pump.
Usually they wean you off of that. You're in the hospital 3 or 4 days and you go home on some type of oral medication, pain medication.
3, are you walking? We got to make sure you are safe to go home. When you go home, the last thing we want you to do is go home and be confined to a chair, be confined to a bed.
My legs were weak. I was still a little bit woozy. The anesthetic was probably still in me a little bit. And they walked me. That was the first time I walked, and I did fairly well.
Next, are you safe in the sense that are your vital signs good? Medically, are you safe? Your blood pressure looks good. Your vital signs look okay. Your heart looks okay. In other words, there's nothing that we need to do medically to make sure that you need to stay in the hospital an extra day or 2.
I wasn't able to navigate as I needed to, even to go home with a spouse. When it came to maybe she should go to step-down rehab, I wanted to. That's how scared I was, and that's how terribly I felt, that I wanted actually to remain, if you will, in the arms of the professionals.
And the last thing really is that you, as a patient, feel you are welcome to go home. You have no more concerns. You have no more anxieties. You feel like what you are there for in the hospital has been met. Your surgery was successful at this point. Your pain is controlled at this point. Your anxieties are met. You are walking, you are safe.
I'm being released from the hospital, going home and realizing that's going to be a different game altogether.
And I was walking around just fine, and the fever subsided, and I started feeling more like Peter, and I was discharged.